Dr. Krista with the American Posture Institute. Are you currently doing postural evaluations with your patients? And if so, are you also testing their cerebellar function? It's really important to test cerebellar function because if your patients have decreased cerebellar function, they're going to have increased postural sway as well as an inability to put together coordinated movements, complex movements in a coordinated fashion. Okay, so you can easily test their cerebellar function while doing your other postural analysis. One thing you can do is to do a typical Romberg's test. So have them put their feet together and close their eyes. They're going to sway towards the side of decreased cerebellar function. This is called postural sway. Another way of testing cerebellar function is to have them do the finger to nose test. On the side of decreased cerebellar function, you'll see that they either move their finger or they just miss their nose completely. Okay, so that way you can determine which side has lower function of the cerebellum. So once you determine this, how do you correct it for full postural correction? There's a couple easy things you can do. First of all, you can do mobilization on the side ipsilateral to the decreased cerebellar function. Another thing you can do is to implement an exercise that they can do in your office as well as at home. Okay, this is a simple exercise. You're going to have your patient run in place. They'll start by looking forward, and then they're going to look to the side of cerebellar dysfunction while they continue to run in place. So you'll have them do this for a few seconds. What you always want to do when testing cerebellar function for full postural correction is to retest their cerebellar function afterwards. If you found this tip useful to you in your practice, then be sure to follow us on Facebook at facebook.com/PostureNationElite for more tips, tools, and resources. Remember, it's posture by design, not by circumstance.